All these places I go to, I'll tell them pretty much the same thing. Now, whether that shows up in a record or not, that's a different story. Let's see. Undiagnosed, 2 years. The only reason I went to a doctor or hospital times 10 in 2 years is this reason. What was I told by nurse Celeste Richardson? Where did you get these pictures? Shock. Oh, whoops. Did I do something wrong? Yeah, I felt like I was in trouble or something. You can get your medical records from hospitals and doctors. I mean, it's the law. She acted surprised to see these pictures. So, I'm trying to be a good patient, Not only am I telling her what's wrong with me, I had to go get the damn pictures, print them out, and I'm just trying to show her as a visual aid where my problem is and what it is. She don't want to see the pictures. Maybe she doesn't know what she's looking at. I bet she does now. Tried to tell me it was behavioral or stress related, my symptoms. I wouldn't acknowledge the pictures. So it's like another psychological designation, fear tactic, talking points from St. Vincent's East. Yeah, I go to a lot of these doctors following going to St. Vincent's East Hospital, and the first thing they say is, yeah, are you stressed out? You look like something's wrong with you emotionally. So they try to play up this psychological designation, and it's just talking points from the hospital. They're told to put this out there and ignore my injury because they tried to cover it up and they failed miserably. Very sloppy job. But hey, it's not as sloppy as what's going on now, and I can't wait to cover that after I finish with this medical stuff. I told her I believed the skull fracture had become infected by parasite worms. She told me there was no basis for that analysis. She said it was too rare. You know what? I've been outside of America, and there's a lot of rare stuff going on in the rest of the world. Yeah, so I told her, hey, wait a sec. There are some reasons, and there are some basis for this analysis, and it is as follows. I had a crawling feeling in my neck. I can feel worms crawling in my neck. They slither from one side of my neck to another, and I can feel that. And I explained my experience with Reese's pinworm medicine. It was effective. Yeah, we're ticking off boxes here. Parasite worm medicine, effective. Crawling feeling, consistent with worm infection. I told her that I want to do a parasite cleanse with some prescription drugs. She tried to discredit me. She hid behind her authority as a nurse, as a licensed medical practitioner when challenged. So, here we go again. This is like a common tactic. Basically, she challenged my sanity in the form of name-calling. I think my conversation was recorded. If it was, please play it for the world and don't edit it because, we had a discussion and I demonstrated that you don't know quite as much as you think you know. Nurse, doctor, 10 years of college, 5 years of college, 4 years at Jeff State. I assume Northside Medical is not equipped to handle this injury.